All right, hello and welcome everyone. I'm Dr. Tom Chaney and this is Living Health Live. Joining me on the show as well as in my life and in our practice, Living Health Integrated Medicine, is my wife, Dr. Steph Chaney. We are your trusted source for the latest information to help you get and stay healthy naturally. We're super excited to be joining you regularly to take you on an adventure of a lifetime, your lifetime of great health. You're going to get some great information, some health strategies, and the latest research on how you can live a better and healthier life. It's intended for educational information only. The information given here is designed to help you make informed health decisions and not intended as a substitute for medical treatment. On today's episode, I've got a special guest, a returning guest. This is Dr. Levy, and we're going to be talking all about Methylene Blue today. Let me just give you a little background on Dr. Levy, very accomplished individual. He's a board-certified cardiologist. He's also a BARD-certified attorney. He has now written 13 books, several addressing wide-ranging properties of vitamin C in neutralizing all toxins and resolving most infections, as well as its vital role in effective treatment for heart disease and cancer. Others address the important roles of dental toxicity and nutrition in diseases and health. He was inducted into the Orthomolecular Medicine Hall of Fame in 2016. He continues the research, the impact of orthomolecular applications of vitamin C and antioxidants in general on chronic degenerative diseases, including heart disease. His ongoing research involves documenting all diseases or different forms and degrees of focal scurvy arising from increased oxidative stress, especially intracellularly, and that all benefit from protocols that optimize the antioxidant levels in the body. So in particular, the cause and effect relationship between oral cavity infections and all heart attacks is now solidly established. So welcome to the show.
Thank you. Very happy to be here, Thomas.
Yeah, it's good to see you again. Just a reminder to everybody, and you can go back and look at our previous blog, but we had Dr. Levy on. That was a big vitamin C podcast, and that's when you brought up Methylene Blue. Started incorporating it into practice personally and in the office with various cases and lots of questions. And now it's becoming more and more mainstream, if you will, more common. We see it out there. So we thought it would be great to have the expert on so we can talk all things Methylene Blue so people get a little more comfortable with what this stuff is. So why don't you just spend a few minutes explaining what Methylene Blue actually is?
Well, as it might appear from the name, Methylene Blue is a dye, and it was developed as a dye for actually industrial applications, and it's very effective. When any of this touches any material, it turns dark blue and it stays dark blue. Somewhere along the line, shortly after it was discovered, it does have the distinction, some people would say negative distinction, of being a completely synthesized drug. And in contrast to so much of everything else we do in orthomolecular medicine, it's not a natural substance, and we're not treating any natural deficiencies of methylene blue, which of course is one of the major points we make against most all prescription drugs is you don't have a prescription drug deficiency, but you do have a vitamin C deficiency or a magnesium deficiency, vitamin D deficiency, and so on. Well, early on in the development of Methylene Blue, and it's still unclear to me with the people that were involved how they came upon this discovery, but they found that in addition to being a dye that they could use in biological purposes, it would stain very selectively different cells. In cancer patients, it would stain along the pathways of metastasis so you could see how the cancer was growing. Somewhere along the line, it started to be ingested, and the really incredible thing found early on was many people, after an initial few doses of the Methylene Blue, completely lost their depression. And as they investigated it more, they found out that although Methylene Blue, being a small molecule that's neutral, not positive, not negative, not really specifically lipid or fat soluble, goes everywhere in the body. But apparently it went very effectively into the brain. And of course, we know the blood-brain barrier is a problem for a lot of agents, not only drugs, but natural substances as well. And so that led to the ongoing use and experimentation. And of course, it's a big story, but that kicked things off to get us to the point where we are today. And I might add that probably if this had been 1900 rather than 2025, I would have been a bit reluctant to jump on the bandwagon because we wouldn't really have any idea at all what the long-term effects were. But we have now over 100 years of safety in the administration of this and virtually no significant side effects except when you extremely exceed the recommended doses, pretty much like anything else.
Yeah.
You go crazy on the dosage, you're going to get undesirable effects.
I've even seen some literature more recent on the history of it being used for malaria. Like it might have been the first drug, quote unquote, drug we had for malaria and treatment of such infections.
Well, it turns out it's not only effective against malaria, as a very powerful antioxidant. What was mentioned in the introduction to me is I'm currently writing my 14th book. And in a nutshell, the book is oxidative stress, increased oxidation of biomolecules is disease. It doesn't cause disease. It is the disease. And the only thing that causes excess oxidative stress are toxins. And that's pretty much the whole book summarized in 2 sentences, but obviously invokes a lot of questions. So in the case of methylene blue, is a powerful antioxidant. So if you look at some of the literature on methylene blue, it almost parallels the clinical efficacy of vitamin C. Now, all antioxidants are able to donate electrons, but how effectively they do it depends on whether they're fat soluble, water soluble, large, small, delivered in a specific fashion, where they accumulate, how easily they're excreted. In other words, 3 given antioxidants, even though they're all capable of donating an electron, don't have the same efficacy on different disease processes because they get distributed in a different fashion. So in the case of methylene blue, it just gets about everywhere in the body. Vitamin C has also been shown to be very powerful against malaria and all other infectious diseases. And it's pretty much the same sort of mechanism involved there. Methylene blue as a monotherapy used all by itself has been repeatedly reported to pull people out of advanced septic shock, including septic shock from COVID and including septic shock where the patient had already coded and needed to be revived. And then they finally put on methylene blue and they were able to pull them out after all the other stuff had failed. So it's a very powerful agent, but it's powerful, in my opinion, from review of the literature. It's powerful because it's an antioxidant that gets everywhere, including your urine. So yes, you get blue urine. I saw some stuff online where it appeared like they were trying to alarm people about taking methylene blue because they had some autopsy studies of brain specimens that had a blue tinge.
Yeah.
Right.
Well, guess what? If it stains you on the outside, it stains you on the inside too.
Sure.
But just the fact that a dye is causing a dye effect doesn't mean it's a toxic effect.
Right.
Okay. So in fact, it could be just the opposite. It could be an indication that you now have in your cerebrum a distribution of methylene blue that's going to make all the other electrons change easier than if it wasn't there at all. So it made for a very cute article, but I don't think people need to get alarmed by it.
Yeah, and I always sort of ask, well, was this particular individual close to the time of death given methylene blue? And in that moment, you know what I mean? Like it hadn't cleared out of the system yet.
They made no mention that I know of is, was this person really dosing it high or very dosing it low? So, and even then, even if it was a higher dose, I don't think the fact that a dye is causing the color stain that it's designed to cause should cause an alarm just because it's taking place inside your body rather than outside your body. If it dyes your shirt, if it dyes your skin, it's going to dye anything else that it reaches inside until you get to an equilibrium where just as much is being excreted as being taken in.
Right. So you mentioned the antioxidant effects There's effects on the mitochondria, nitric oxide modulation. Can you just sort of go through the list of like how it actually works, what effects it creates that are so significant to our function and health?
Well, basically, I put it down as basically twofold. The first is it has the wonderful antioxidant properties. I mean, nobody loves vitamin C more than me, but it has the wonderful antioxidant clinical properties. Has a clinical properties of vitamin C in terms of resolving infections by all the different mechanisms that an antioxidant does that, neutralization of toxins by all the mechanisms. But then, I'm not saying vitamin C has no effect at all in this regard. I suspect it does if you deplete the body of other substances. But what methylene blue, because of its incredible penetration in getting concentrated inside the brain, it gets concentrated inside the cells and specifically inside the mitochondria. Now, what does everybody talk about these days? Mitochondria, energy, mitochondrial fatigue. Well, hey, I think we have the answers. So let's just stop asking the questions and let me give you the answer. Now, as a very much of an oversimplification, I'm not much of a biochemist. I don't claim to be. And whenever I see a dozen equations on a page, I just try to come to a conclusion and forget about the details. But in general, the energy dynamics of the cell relate to the glucose that's brought into the cell by insulin. It also brings in vitamin C, incidentally. The glucose it brings in, and then basically the glucose being metabolized through the Krebs cycle in the mitochondria, ultimately coming down to the ability to donate electrons to what's called the electron transport chain in the mitochondria. So glucose, Krebs cycle, supply electrons, and then in the course of going through this electron transfer chain, if it's working efficiently, you make more and more ATP, which for anybody listening, they need to understand that ATP, adenosine triphosphate, is the most important energy delivering molecule in the body. So vitamin C supplies a lot of energy, but ATP has a unique mechanism in which it's able to give its electron energy or project this energy into different equations. So now here we have the electron transport chain. This is an involved answer, but I think it's important to understand the whole picture. Back in the 1960s and 1970s, Dr. Abram Hoffer, an incredible orthomolecular psychiatrist who really did a lot for orthomolecular medicine, he found that he could cure, and I know cure is a four-letter word, but he was able to cure a majority of chronic schizophrenic patients with large doses of niacinamide or niacin, plus a little vitamin C. Why was he able to do that? Well, as it turns out, niacin or niamide is a vitamer, a non-flush version of niacin, which I favor because so many people get turned off if they start getting a flush reaction. I just say, let's not even go through that scenario, go straight to the niacinamide. Well, when you're looking at the electron transport chain, that's what I said is a sequence of reactions. And I know this much about chemistry. In order to keep a reaction going, you need to keep on adding substrate. You need to keep on, you need gas to burn. You can't burn all the gas and expect the reaction to continue. You got to keep on giving fuel, keep on giving substrate for one thing to be converted to another. Well, what the niacinamide did, and Dr. Hoffer would use 6 grams or more a day, 6,000 milligrams or more a day of niacinamide. And niacinamide is direct precursor to NAD, nicotinamide adenine dinucleotide, which is the first substance in the electron transport chain. And I'm sure you and many of the people listening to this understand that it's almost a faddish type of thing. I'm not saying it's unimportant. Is let's just kick up the NAD. So there have so many different NAD supplements, injectable NAD. Well, that's fine and good. And it's going to help you. And it's going to cost a lot. And it's not going to be as efficient as if you just take a large dose of niacinamide and you start manufacturing the amount of NAD that you need, and at a much lower price. So we have niacinamide doing this. And why does schizophrenia resolve? Because like every other disease, schizophrenia is chronic encephalitis. It's a chronic inflammation of your brain. And just like I said at the outset here, all disease is increased oxidation. Inflammation is increased oxidation. So when you get enough substrate in there in the form of antioxidants to start neutralizing all of that, all reversible damage comes back. All right, so we have the NAD. The second stage is FAD, flavin adenine dinucleotide, which interestingly is fed by vitamin B2. Niacinamide and niacin is vitamin B3, and vitamin B2 is riboflavin, and that's the direct precursor to FAD. Then the third stage is coenzyme Q10, which feeds back on the first two stages and is very powerful by itself. And then comes number 4. Number 4 is cytochrome C oxidase, which don't get wrapped up in the title of the word. It's the fourth stage that receives the electrons that come down. And in this case, for, I guess, unique interrelationships of molecules that have a greater affinity for one site than another, methylene blue has like an arrow right toward the C oxidase, donates its electron to vitamin C oxidase, and massively upregulates ATP production all by itself without even invoking the first 3 steps. And then you have the additional benefit that in doing that, all positive biological pathways generate oxidative stress. So you don't generate the oxidative stress that needed to be generated to get to the point where methylene blue could upregulate the ATP.
Got it.
And actually, that's the reason. And before I say this, I'm going to say I don't sell these supplements, so I'm not making an ad here, but I have what I call my Super 8 supplements. And they're vitamin C, magnesium, vitamin D, and vitamin K2, all of which bring calcium down inside the cell, which individually dosed will decrease all-cause mortality, decrease your death from anything. And then I have the energy side supplements, which are niacinamide, riboflavin, coenzyme Q10, and methylene blue. And the good thing about this is all 8 of these are extremely non-toxic. And if you don't get a positive effect, you take a greater dose. If you do get a positive effect, you're free to increase the dose even further until you reach what you think you're getting your maximal benefit. Because remember, we live in a toxic cesspool, all right? And everybody's unique toxin load is different. And if you have a light toxin load today and a big antioxidant intake, that doesn't mean the last weeks or months have been forgotten. All those toxins have also accumulated. And as the old expression goes, you got to pay the piper, all right? And you got to pay the piper on a regular basis before you ever start to get ahead of the game. And in getting ahead of the game, then we need to go into all the different sources of new toxins.
That was the best explanation I have heard of the mechanism of how methylene blue donates its electrons without creating oxidation.
Yes.
Amazing. Okay, good.
So you said the Super 8, one of them is methylene blue. So tell me how you take it, and then maybe just go into all the different ways that we can consume it.
Well, for a long time, I just took the drops, which you have to be careful. If you get sloppy, you pay the price, or you end up with blue something all day long. And you can form a habit and do it right, but it's a little bit of a pain. And I found a company that puts the methylene blue inside tablets. And so I take one of those tablets a day, which I think has 15 milligrams in it. So it's a good low baseline dose of methylene blue. Really, you only really have the oral and the IV. The IV is really only, in my opinion, if you have a situation where oral intake is no longer feasible.
Okay.
So somebody's intubated or this, that, or the other, even if they have a GI tube, it's a whole lot easier than just like the septic shock patient. I mean, obviously, those are what you're using intravenous methylene blue for. But because methylene blue is such a small molecule, so easily taken up in all the cells and easily blue, you pretty much get the same impact from a good oral dose as you would from an IV dose. What I was saying, in a nutshell, IV is most useful when oral is not feasible.
Yeah.
All right.
Unconscious
and other than
patient.
that, like, we give other things IV and we just think automatically it's better than taking orally. Most of the time, that's true. But in the case of methylene blue, it really gets so well absorbed, you're not really getting, in my opinion, that's not like I've done a big research on this, in my opinion, you're not getting this super overwhelming extra positive effect by taking it intravenously.
Do you take it away from food, I'm assuming, because you wouldn't want it necessarily just mixing with whatever you ate, or does that even matter?
You don't mean mixing it up out before you
Well, I mean, like taking it in the middle of a meal versus an hour or two away from food or something.
I don't think it's important whether you stage your food a little bit or not.
It's hitching a ride in the food, or it's
yeah, right. It's going to take a ride either way. So
okay.
No, I don't think that would be important.
So you mentioned some of the benefits. So you mentioned, for example, depression and increased energy. So what are some of the other benefits that you've seen?
Well, the depression and the information that I told you about niacinamide and Dr. Abraham Hoffer with schizophrenia should trigger the concept that methylene blue and anything else that powerfully upregulates ATP, especially inside the brain, is going to help all central nervous system, psychiatric and non-psychiatric conditions, autism, you name it. It's going to help everything. All right. Obviously, from one person to the next, it's going to be an individual reaction. You're certainly not going to know before you get going as to how profound an effect you are, because, like I said, everybody has a different toxin profile and everybody has different things that need to be accomplished metabolically and physiologically. But no, I mean, you can expect methylene blue to help dramatically, in my opinion, just about anything going on in the brain and the CNS. And substantially so for the rest of the body. I got to say this, I've probably been taking methylene blue personally for about 2 years now. And a friend had told me about it. I did some research and I wrote the paper that I did on it. And at that time, I was on my basic supplement profile that had me feeling pretty good. My vitamin C and my D and all the other things that I told you about, plus other. I added the methylene blue, and for me, man, I just went up another 10, 15%.
Wow.
I just layered right on top. And people need to realize, too, that this sounds kind of funny, but a lot of times if people are going to start a new supplement, I strongly recommend them to just write down on a piece of paper their most prominent symptoms, whatever their symptom is, headache, muscle ache, dizziness, you name it, and rank the symptom. All right? And then start the supplement, and several weeks later, reevaluate. You say, well, that shouldn't be necessary. Somebody knows that they're feeling better. Not really, okay? Because 30 years ago, when I was with Dr. Hal Huggins, his clinic, the biological dentist, when people would come in for their dental work, their diet, their supplements, they fill out a form, and they fill out this symptom questionnaire. And most of them were feeling pretty good when they left. But then myself or somebody else or Dr. Huggins would do a 2 or 3 month phone follow-up with these people, right? And they'd have a new set of blood work, and they'd have another questionnaire. And I can't tell you the number of times I say, well, okay, Mr. Jones, how are you feeling? Well, okay, I guess. Okay, any better? Pretty good. I said, okay, well, are you still having that horrible pain that you had in your knee? No. Okay. And how about the 4 or 5 headaches you get a week? Well, no, I'm not getting headaches anymore. And I mean, it would just go. I mean, it's human nature, I suppose. Maybe it's greed, maybe it's whatever you want to call it, but we just focus in on what we don't have.
It's the new normal.
We no longer appreciate what we do have. We just say, well, all of that's fine now, but I still have this, and it didn't relieve that. So
yeah,
that's a hard standard to hold up to. But it's incredible, though, how many people were extremely gratified at the end of the phone call to have it pointed out to them how well they were responding.
Right. They forgot. They don't have those. They don't think of those symptoms anymore. They're out of sight, out of mind.
Nobody appreciates good health. They only appreciate illness. To me, the most incredibly rare person on the planet is someone who's always been in good health, yet has the frame of mind to still eat an extremely healthy diet and supplement appropriately. You practically never find anybody like that. People only focus in on something when it's a symptom. And I'm not saying that's not human nature. It is. But somebody who supplements who's never had a serious symptom is the rarest person on the planet. We always do it in a reactive fashion to make ourselves better.
Agreed.
So what might be some contraindications, like absolutely do not take methylene blue under these circumstances?
Well, they have what's called the selective serotonin reuptake inhibitors, which are, I'm not even going to say what they are, I might misstate it, but it's a clear classic list of antidepressants. And because of the way they affect serotonin metabolism, if you take too much, not if you take any at all, but if you take too much methylene blue, it induces a serotonin type of overexpression syndrome, which can be anything from uncomfortable to fatal. All right. It's your responsibility as a doc to have a list of these agents down there and make absolutely certain that you know your patient's not taking them. Okay. So, but outside of that, very little problem. There are some patients with the old G6PD, glucose phosphorus dehydrogenase, that they talk about with vitamin C. If you take it the wrong way, you're sensitive, hemolysis. Those two, in the same way as vitamin C, can be a problem. I mean, if you have a G6PD deficient patient, you should start out with small doses and build them up just like you would with vitamin C. But outside of those two examples, there's really, that I'm aware of off the top of my head right now, no significant contraindications that I know of, other than if you're going to throw a fit at seeing blue urine.
Now, one of the things you mentioned was this conflict with the serotonin reuptake inhibitor medications. And is that because methylene blue actually helps the body produce more serotonin? Does it help? Does it convert to, like, what's the...
Just too sophisticated a question.
We just know it happens.
I don't know.
Okay. Okay. All right. What about just kidney issues in general?
Kidney?
Like if they've got a kidney disease or if they have like low filtration rate, do we get concerned with methylene blue, or just still keep it low and no big deal?
Still keep it low, but the thing is, as long as you're having a good urine output, don't steer clear of it, because going back to the initial statement, all disease 100% is increased oxidation of biomolecules, and the kidneys are no exception. Mm-hmm. And although it gets appreciated very little these days, all the studies who still have the hysteria over vitamin C and kidney stones and kidney disease, well, guess what? You do it right, vitamin C and methylene blue, but especially vitamin C, has been well documented to improve compromised kidney function. All right. It's like any other tissue. You can't have kidney disease without areas of the kidneys being under increased oxidative stress. And what's the primary way of dealing with increased oxidative stress? Well, taking vitamin C, and if you can identify it, trying to eliminate whatever the toxin is that was causing the oxidative stress to begin with. So no contraindication there, just an increased awareness. For example, this doesn't pertain so much, well, it can pertain to methylene blue too, for the G6PD patient. They always say, how do I make sure that I'm going to be safe when I give IV vitamin C, for example? Well, the thing is, what does an IV and what does vitamin C in the IV always do? It has a diuretic effect. It increases urine flow. So with that in mind, you tell the patient, you make sure you tell the patient, as we're doing this, when you go to the bathroom and when you need to urinate in the middle of the IV, you need to let me know if the urine is darker than when you went in. If it's darker, then you need to stop, because the only two other things that happen is it stays the same, or more likely, because you're getting a diuretic effect, it gets lighter. So if whatever you started at, it gets darker, just assume that you're having a G6PD mild hemolysis, and you stop that. And then you take some other measures like some furosemide or Lasix, a high volume saline infusion to open up volume, promote excretion through the kidneys. But again, it's just listen to your patient and make sure your patient knows what you're concerned about or potentially concerned about.
Great. So it sounds like, there's very few risks, and really it's very beneficial. Should somebody, when they're out there looking at supplements, is there different grades? Should, somebody look for a particular grade of supplement? You talked about in the beginning, we use this as an industrial use to basically dye our clothing. So that's probably not the grade that you would want to ingest, if, that's my thought process.
No, only because they don't purify it in your genes. But very simply, there's two categories. There's USP, or pharmaceutical grade, and the rest. Anything that you're supplementing has to say on the bottle or on the pill or on the powder, USP or pharmaceutical grade. And then that you can proceed with quite comfortably.
And what about dosing and or cycling?
Cycling?
Yeah. So like, do you ever take time off from Methylene Blue or take breaks, or do you just take it continuously?
Well, I will say this. I've taken it continuously, and when I talk about supplementing, I'm talking about daily, but I don't know for a fact that doing it intermittently or taking time off might not be a reasonable thing to do, but I certainly don't think, on the evidence that we have over time, that is necessary. On the other hand, if you're worried about getting blue organs, then maybe you want to take a few days off.
Now, if you're handling something, because I've seen a lot more patients out there, some of it's on the internet and whatnot, implementing this into their cancer protocols, chronic fatigue protocols, all of the whatever protocols that they bring Methylene Blue in, they may dose up to, let's talk about maybe what the max dose you'd ever even consider would be, but they shouldn't necessarily need to be living at that high dose. So at some point they would be cycling down to more of a maintenance dose,
Well, they have in my paper, they have a amount per kilogram per day maximal dose. For if you're giving intravenous, then you need to go along those guidelines, especially if you want to push it up to a maximal dose like you would, for example, with somebody in septic shock. Okay. But short of that, 15, 20, 25, 50 milligrams a day, we have no indication at all to indicate that any of those things are toxic, even in the long term. I got to add this. We live in such a legitimately conspiratorial world these days, don't we? I just knew for a fact Methylene Blue had to be great for cancer. And you have a lot of people that give it for cancer. But if you go online on PubMed,
oh gosh,
if you go online, you'll find a lot on Methylene Blue and cancer, but you will find zero studies that talk about the impact of giving Methylene Blue on patients with cancer. It's all test tube studies.
Yeah.
Test tube study.
In vitro.
It's very glaring as to how absent it is. It's the natural next step. If you're seeing something in the test tube, especially we're talking about over 100 years. Yeah. We're not talking about they just found things out in the last few years. It was a 100-year-old study that was the single only study that I saw on giving Methylene Blue for cancer. And it was quite positive, as you might expect. But somewhere along the line, Big Brother said, "Thou shalt not study Methylene Blue in patients with cancer." Is the only conclusion I can receive, because it was very bizarre. I covered that in the paper that I wrote.
Yeah, it's an off-patent. There's no real money in it versus all the lovely expensive.
Well, I think you hit upon why.
Did I say that out loud?
So you mentioned a paper. Where can our listeners find that paper?
Well, just go to my website, tomlevymd.com, tomlevymd.com. And it has article section. You click on that and you go down to what's called the orthomolecular medical articles. And it's like about the fourth or fifth from the last article that talks about what's the title of it? The title of the article is Resolving Colds to Advance COVID with Methylene Blue, but it covers the general subject of methylene blue, and it's got 150 or more references, so people can
that's great.
Feel very good about going straight to the literature, because nearly all of them have PMID numbers where you just type in the number, boom, and you got the abstract of the article.
Now, the other thing I'm reading about is methylene blue with near far infrared light, and it being more impactful, if you will, if you're ingesting it and then exposing yourself to red light. What's the deal with that?
You know, they're both very good. And the literature would have you believe that the photodynamic therapy also impacts electron donation to the cytochrome C oxidase in the electron transport chain. Having said that, it would seem like they're synergistic, and maybe there are, but I could never, to my own comfort, really identify protocols that clearly establish that. So I think it's a fine idea. I think that the red light therapy and the photodynamic therapy is good for a lot of stuff, and I wouldn't want to discourage anybody from not only adding that to their methylene blue therapy, but for any other thing, okay? But I was not, to my satisfaction, able to reach the definitive conclusions that I wanted to in researching the interaction of those two modalities.
Yeah, it seems like a little bit of maybe reaching. That's okay.
Well, we're also never clear, too. Your methylene blue, and then now where am I going to put the photo? I mean, you didn't know if you're swallowing it, if you need to shine the light inside the throat. It was never very clear how it should be applied, what sort of duration, what sort of intensity, along with what sort of dose of methylene blue for what sort of condition.
Yeah. Or like you said before, in vitro studies. It seems to be quicker
right,
uptake with red light exposure.
Exactly.
Yeah.
Right. That's right on. Yes.
Yeah, the petri dish kind of thing. Excellent. What about breastfeeding our pregnant women? Do we just use normal precautions like better safe than sorry to avoid it?
Well, I guess it sort of amazes me how we.
I know.
Well, no, I don't go on the sidetrack. As to how in some areas we seem to care so much about an infant health, in other areas we don't. Let's put it that way.
I totally understand what wavelength you're on.
And the thing is, going along with that, I would say it's probably best for a pregnant woman to avoid taking methylene blue, since we don't really know if methylene blue has any unique effects in the fetus. And I have no doubt, although I don't have an article to prove it, I have no doubt that you're going to give methylene blue through the nursing, and you'll be able to, I'm sure, give some in the pregnancy to the developing infant. So I would say, it's probably a good idea, unless, of course, you're deathly ill. Hey, if suddenly something happens, you're in septic shock, your little infant will have to take a joke.
So your dosing is, the 15 milligram. That's a good, easy, safe dose for anybody to take daily, ongoing.
And it's on the low side. I mean, because of the coloring side effect and this sort of thing, I'm more reluctant to advise long-term chronic higher dosing than I would be on pushing coenzyme Q10 to a gram a day, on going with riboflavin 400 milligrams a day, on taking niacinamide 1, 2, 3,000 milligrams a day. No problem pushing on those, but maybe at some point in time we'll have a few more studies, since there's so much interest now that seems to be developing over methylene blue. Maybe we'll have some more information in the upcoming months and years.
Now, some people will report if they get to a certain dose, and it may not even be a high dose, they might notice that they get headaches. What do you think is behind that? Or is that just they don't need that much?
This would just be speculation, but I would say if they're getting headaches, they're, for lack of a more elegant scientific phrase, you're stirring things up inside the brain, and we know what methylene blue does inside the brain. What I might do is back off on the methylene blue and then push on those other three supplements harder to push on the increasing the ATP and then maybe reintroducing the methylene blue down the road. But that's nothing I would panic on. But we all have to remember, too, for very ill-defined reasons, even though we have the same basic biology, we have so many different things, interacting with so many different things. Everybody's different. And I mean, you'd have some people, for example, and it amazes me, but it's true, they take 500 milligrams, not even a gram of vitamin C, and they get diarrhea. So you have other people that take 80 grams and don't. All right. So I never want to discount physiological differences. So that would be what I'd say about that.
Yeah. And people have different levels of toxins and,
Exactly.
viral load.
And where the toxins are located.
Right.
Exactly. And any one thing can trigger a toxin release in one situation where it doesn't in another. And when you release toxins in the bloodstream, what do you get? Acute oxidation.
And then you do a coffee
which is the cause of all symptoms.
Okay.
A lot of people don't think it that way, but
Yeah.
any negative symptom you have, any one, is due to increased oxidative stress in some location in your body.
Makes sense.
Absolutely.
Awesome. All right. Do you have any other questions, Dr. Tom?
I think we covered it all. Appreciate your time today.
Pleasure.
It's a popular subject now, social media, which is good. And we just want to dial in on getting people comfortable with taking it and why they might take it and how it works. And
The funny thing, too, is we have what I call closet methylene bluers. When I wrote this article 2 years ago, nobody other than my friend that led me into it had ever heard methylene blue ever mentioned. I mean, I knew somewhere in the back of my mind, methylene blue, methemoglobinemia, that sort of thing.
Yeah.
Nothing else. And then after I wrote this article, and I'm not trying to take credit for the world's awareness of methylene blue, but after I wrote this article and I started going to conferences, oh yeah, Dr. Levy, I've been taking that for 20 years now. Really? I mean, so and then they finally felt like, well, maybe now I won't be considered a weirdo for admitting to it.
Yeah. Oh, yeah. Why am I drinking a blue dye?
Exactly.
Go explain that one to your friends.
Well, I think we did that. I think we explained, the benefits, how it works in the body. So now people can kind of put all the pieces together and understand if they are taking it, why they're taking it, and some of the benefits. So once again, thanks for joining us. You've been listening to Living Health Live with me, Dr. Tom Chaney and Dr. Stephanie Chaney. If you have any questions or if you want to hear about a topic in the future, you can always reach us at info@mylivinghealth.com. And we look forward to seeing you on the next episode.
Thank you.